Hello, today I will be presenting on a drug class known as antihypertensives, specifically ACE inhibitors. Antihypertensives are medications used to treat high blood pressure, also known as hypertension. Controlling blood pressure is extremely important because it helps reduce the risk of serious conditions like heart attacks, strokes, and kidney damage. The specific subclass I will be focusing on is ACE inhibitors. ACE stands for angiotensin converting enzyme. Two common prototype drugs in this class are lisopropanol and enalapril. These medications are widely prescribed and are considered first-line treatments for many patients with high blood pressure. To understand how ACE inhibitors work, it's important to look at the renin-angiotensin aldosterone system, also known as the RAAS system. Normally, the body produces a substance called angiotensin 1. This substance is then converted into angiotensin 2 by the angiotensin converting enzyme, or ACE. Angiotensin 2 plays a major role in increasing blood pressure. It causes blood vessels to constrict, which means they become narrower, and this raises blood pressure. It also stimulates the release of aldosterone, which causes the body to retain sodium and water, further increasing blood volume and pressure. ACE inhibitors work by blocking the angiotensin converting enzyme. This prevents angiotensin 1 from being converted into angiotensin 2. As a result, blood vessels relax and widen, which is called vasodilation. This leads to a decrease in blood pressure and reduces the workload on the heart. The pharmacological principle behind this is enzyme inhibition. By inhibiting the ACE enzyme, the drug reduces the production of a substance that normally increases blood pressure. ACE inhibitors are primarily used to treat hypertension, which is their most common indication. They are also used in patients with heart failure because they help reduce the workload on the heart and improve blood flow. In addition, ACE inhibitors are commonly prescribed after a heart attack to help prevent further damage to the heart. Another important use is in patients with chronic kidney disease, especially those with diabetes. These medications help protect kidney function by reducing pressure within the kidneys. Some off-label or extended uses include preventing cardiovascular complications in high-risk patients and slowing the progression of certain kidney conditions. Like all medications, ACE inhibitors have side effects, and understanding why they occur is important. One of the most common side effects is a dry cough. This happens because ACE normally breaks down a substance called bradykinin, and when ACE is blocked, bradykinin builds up in the body, which can irritate the airways and can cause a persistent cough. Another side effect is hyperkalemia, which means high potassium levels. This occurs when ACE inhibitors reduce the release of aldosterone. Aldosterone normally helps the body get rid of potassium, so when it is reduced, potassium is going to increase. A third common side effect is hypotension, or low blood pressure. This is especially likely after the first dose because the blood vessels suddenly relax and widen. ACE inhibitors also have a very important black box warning. They should never be used during pregnancy because they can cause serious harm or even death to the developing fetus. There are also key contradictions. These drugs should not be used in patients who are pregnant, have a history of angioedema, or have severe narrowing of the renal arteries. One major drug interaction to be aware of is with potassium supplements or potassium-sparing diuretics. When combined, these can lead to dangerously high potassium levels, which can cause serious heart problems. When patients are taking ACE inhibitors, there are several important things that healthcare providers need to monitor. First, blood pressure should be monitored regularly to ensure the medication is working and to prevent hypotension. Second, kidney function should be checked through lab values such as creatinine because these drugs can affect the kidneys. Third, potassium levels must be monitored to prevent hyperkalemia. There are also key patient education points. First, patients should be advised to take their first dose at night. This helps reduce the risk of dizziness or fainting due to a sudden drop in blood pressure. Second, patients should be told to report a persistent dry cough, as this may require switching to a different medication. Third, patients should avoid potassium supplements and be cautious with high potassium foods, since this could lead to dangerously high potassium levels. Patients should also be reminded to change positions slowly, such as standing up gradually, to avoid dizziness. In conclusion, ACE inhibitors are a widely used and effective drug class for treating hypertension and protecting the heart and kidneys. They work by blocking the production of angiotensin 2, leading to relaxed blood vessels and lower blood pressure. However, they require careful monitoring and patient education to prevent complications and ensure safe and effective use. Thank you for listening to my video assignment.